Thank you so much. Good morning, everybody. Welcome to the February 18th, 2021 Public Safety Subcommittee of Simsbury. If we could all rise and have the chief lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you as always, Chief. Appreciate
Thank
that.
you.
All right. Hope everybody's doing well. We have a couple of us, including myself, that need to drop off at various times. So we will juggle around. In the packet, we have our minutes from the 21st. Any questions, corrections, updates from there? All right. Hearing none, those will stand. Maria, Melissa, I didn't get any public comments myself. I presume there were none received by your offices. Okay, no public comment. All right. Do we have Jennifer on this morning for the Health District? I did not see Jennifer. All right, I know they've been, there's been a lot going on. Maria, do you want to just do the high level? Oh,
I just got a phone number in. I'm not sure who that was.
Okay.
It's Kristen.
Oh, hey, Kristen.
Good morning, Kristen. Good morning.
All right.
Great. Yeah, absolutely. I don't mind giving an update with the stats that I have. They might not be quite as up to date as Jennifer's, but they're pretty current.
All right. Thank you.
You're welcome. Well, good morning, everyone. So we're continuing to monitor the DPH municipal COVID alert system. And we still remain at the red alert status, which means that we have 15 or more cases per 100,000 people. The good news is that the stats we have seen for the last 2 weeks, we have seen fairly steady declines in the last 2 weeks. And that's the first time that we've really seen substantial declines, I would say probably since late summer or fall. So it's good to see things, finally positive, trending downwards again. So it's very positive. For the most recent 2 week period that was ending February 6th, we had 20.6 cases per 100,000 people, and that was down from 26.6 from the week prior. So again, a good decline there. The positivity rate was 3.2% for those people being tested. And over that most recent 2 week period, we had 72 cases. Again, all throughout really the holiday season, we were pretty consistently seeing that number around 100, 105. So to see that 2 week number come down to 72, again, that's a really good trend downwards. In terms of the vaccines, the health district had let us know that they administered 850 doses of the vaccine last week at one of the clinics that they had held. And that the CVS and Avon has also started administering COVID vaccines as of last week. We also have some preliminary data from the state that was ending February 11th that reported just under 3,100 of our Simsbury residents have received at least the first dose of their vaccine. That's about 12.2% of our residents. And a little over 1,200 of our Simsbury residents that are age 75 and older have received at least their first dose of the vaccine. And that reflects just under half of our residents who are 75 or older. And so while they may represent about 6.6% of our overall population in town, they currently reflect about a third of Simsbury residents that have been vaccinated to date. And again, that's because the state has prioritized folks in that age group for receiving the vaccine. Our senior center and social services staff has been doing a phenomenal job assisting with registering folks. But I'll defer to Kristen for her section of the report to go into more detail on that. In general, our workforce is remaining largely healthy. For the month of January, we did have 9 staff members that were quarantined due to coming into close contact with a person who had tested positive. And just as a reminder, that could also be not only in the work setting, but in their personal life as well. And for the month of January, we had 1 staff member that tested positive. But because of this, we are experiencing staffing shortages at times. So our responses for non-emergency matters may be delayed. And again, we're just reminding folks to please be patient with us when that occurs. But the important thing is that all of our critical infrastructure and services are fully operational. In terms of our staff members, we do have a small number of staff members that have received the vaccine, largely because they respond to medical calls for service. or our clinical social workers. The rest of our staff has not yet received the vaccine. We are still awaiting more clarification in terms of which of our staff members will fall under that frontline essential worker definition. But what we are hearing is that some of our staff members may be eligible under phase 1B to receive the vaccine sometime in March, but it's still pretty vague for us at this point. We are continuing to welcome walk-in visitors to Town Hall and the library. As a reminder, Town Hall walk-in hours are Monday, Wednesday, Friday mornings, and the library is open Tuesday, Thursdays, and Saturdays. The library does continue to offer curbside pickup and technology appointments on the days in which they are not open for walk-in visitors. And a couple of other quick announcements. We did implement the tax deferment program again for the tax bills that were due January 1. We received that directive from the state, and we followed suit with the program that we had implemented in July of this year. We had about 31 approved applications this time around for a total amount of deferred revenue of $315,000. This is down considerably from the July installment, where we had almost triple the number of applications and almost triple the amount of deferred revenue. So that was a good, again, trend downward to see happen. And similarly, we checked on our active unemployment claims. As of January 9th, we had 654 active unemployment claims in town. This is down from a high during the pandemic, right before phase 1 reopening. We had a high of 1,418 unemployment claims in town. But just to give you a comparison in terms of pre-pandemic numbers, we would typically average about 125 claims. In the winter, a little bit higher, maybe 150, 160 claims. So again, that 654 number is still, considerably higher than that. So we definitely have some folks still being affected by the pandemic. And that concludes my report for today.
Thanks, Maria.
You're welcome.
Any questions there? All right. If you would do me the motion, I would just ask that we amend the agenda quickly to go to other business. Just because I do want to bring up a cyber update before I leave. So is there a motion to amend the agenda to do a quick cyber update?
So moved.
Is there a second?
Second.
All right. Any discussion? All those in favor, please say aye. Aye. Any opposed? Thank you for that. So we had an executive session, which obviously I won't go into the details with, recently with the Board of Finance and the Board of Selectmen surrounding our cyber exposure, cyber coverage, cyber threats in general, which include what we all know, the traditional hacking, ransomware, et cetera. There's also social engineering fraud, where an employee is coerced into changing banking information, et cetera. Record retentions, the full gamut of cyber. So the good news is, the town is in good shape, but it became apparent, and through Rick Pisano is the one that suggested it, that this body ought to begin to talk about the cyber exposure, because it is a public safety issue. In that, I won't go into what potentially could be at risk, but as I think you all are aware of, you all are in charge of some pretty important systems. So we just want to make sure that we're prepared for that. This is a new type of event, I think, for us as a body, in that we drill on hurricanes and public safety issues involving, active shooters or other things. But in the cyberspace, I want to make sure that we have a clear playbook for how it works. And it's a new thing for us, in that an insurance carrier, a risk manager, needs to be involved pretty much from the moment of discovery. So all of us have different responsibilities than the call out to the EOC, and we have a discussion and we go through the different steps. So what I'd like to do is propose at an upcoming meeting that there be a tabletop exercise led by Maria, Melissa, and include Rick Pisano with this group to simulate a cyber event, what we all do, how the school side works, how the town side works. And Neil, if we could coordinate and have Matt included in that, I think it'd be important, because we just want to make sure that, when we say the town, we mean both the Board of Ed and the town of Simsbury. The insurance coverage covers both entities, and there are very strict and important things that we need to hit and do to make sure that we're properly handling an event. Again, I don't think one will necessarily ever happen, but given that municipalities are generally under attack, as we've seen at the very high level, right? Atlanta, other places, we just want to make sure that we put this in our bag of areas that we've drilled on, and that we flush out any issues or concerns or confusion that we might have in this space. So we're going to have that at an upcoming meeting, and use it as a tabletop exercise. So Mike Berry's on, right? I don't believe he is here.
No, Mike is not on, but he's aware of this and
Yeah.
some of the information there.
Okay, thanks, Jim. Yeah, so obviously we'll have Mike run point on that, as he does for all our drills, from an emergency management standpoint. But again, Maria, Melissa, and Rick Pisano will help us through that as well. So not a big deal, but just something that came up, and we thought it might be a good idea to run it through this group. So any questions, reactions, feedback on that? All really excited about that, I know.
Hey, Sean, in addition to Matt, will we need our director of technology in that?
I think that would be important. Yeah, you're right, Neil. And again, honestly, an open invitation to anybody that you all think is important to be part of that conversation. And I'd rather have too many people than too few, at least with the initial go around. And again, make sure that, we're updating our procedures and having a clear line of sight for the event happens. What do we do? And it's very different than what happens today with the event, right? And you all are the professionals and you know how those events go. But this one, we don't go to the radio and call outs and our protocols. We go to the insurance carrier and the risk manager and the breach coach. And there are very defined steps that we need to follow in order to make sure that we've protected our critical systems and made sure that we can continue to function. So, Maria, any more comments or thoughts on that? You were part of that conversation as well.
You covered it really nicely. Thank you.
Okay. All right. I appreciate you indulging me in the cyber exposure. We'll get back to the agenda. So next, Maria, you're up again, town manager.
I skipped ahead just because Jennifer wasn't here.
Beautiful. So nothing else?
That's right. Nothing else, but Mike did send along some notes to Chief Baldus and I, since he'd be unable to attend. I think Chief Baldus is going to cover Mike's report.
Beautiful. Chief,
That's fine.
floor is yours.
Okay, so for Mike Berry, who's unfortunately unable to attend because of a meeting conflict, I'll read to you what he sent for his report for this month. Under COVID-19, he said the vaccinations are continuing through the Farmers Valley Health Department. However, we have moved away from the main firehouse here in Simsbury as the venue continued to grow in size. We were not able to continue to accommodate the number of people they wanted to try to get through. And they've been working with Farmers Valley Health with several options to hold clinics in town. However, right now they are using East Granby High School as their main site on Wednesdays right now. He continues to put out a weekly incident action report, which is submitted obviously to the state as well. We have had several snow and weather events, as everybody is certainly aware, and I'm sure their backs can feel it. Communications with Eversource has been definitely improving, which is good news. And contact is being made before, during, and after the storms. So, Mark, thanks to you and your crew out there. WSIM continues to put out information to the public on local issues and bulletins from various town departments. And we are looking to also have an exercise in addition to the one that was just discussed regarding our spring flooding situation along the Farmington River. So that's something that we'll be focusing on. And also at this time, I'd like to announce that we have put in place a new assistant emergency manager. His name is Jim Traficante. Jim comes to us with 20 years of experience with the Providence Fire Department, having retired after 20 years. He is currently active with the U.S. Air Force at Bradley Field as a wing command chief. And he will be basically retiring another couple of months from there. And he is finishing up his BS with emergency management And we really look forward to welcoming Jim on board here. And you should see him in the upcoming meetings. So that's what's from Mike.
Excellent. Thank you, Chief. All right. Any questions for the chief? All right. Chief Bolter, Assistant Chief Davis, Police.
Hi, good morning, everyone. Just wanted to welcome Jim Trafficante to the group. Looking forward to his involvement with us. Just a quick update on our public safety radio system. So we have some fairly good news on that most of the equipment is here or on its way here, and we should see an anticipated completion date of this spring. So that is very good. Since our last meeting, sort of moving on to COVID-19, since our last meeting, one member has been out and is still quarantined due to COVID-19 positives in the household. But the members of his household are all doing well now, and we expect a return shortly. We're doing okay with our PPE. We had to make some recent purchases for gloves, and as anybody who has been doing some purchases all related to COVID-19 equipment, the cost is a little bit through the roof on those, which is very disappointing, but we were able to get some gloves, which was a good thing. And just a thank you to the Farmington Valley Health District and the VNA for some very efficient vaccination clinics. Those have been excellent, both here in town and in East Granby. Our newest officer, Sean Crowley, is expected to complete his on-the-job training in early March and then be at a solo capacity. So you should be seeing him out and about. Feel free to flag him down and introduce yourself to him. We expect to see another new face, Eric Papalarczyk. He'll be joining the department at the beginning of March. He has served as a Hartford police officer for the last 2 years, and he is expected to be in the training program for about 2 months as well. Even with the 2 recent additions, we are still short 3 officers and 1 dispatcher. So word of mouth is often a very good way for these things to get around. But if anybody's looking for application material for a police officer, it's available on policeapp.com. And as I said, please spread the word on that. The applications are available 24 hours a day, and it's fairly clear in there what the process is for application. We just completed another annual review for CLEAR, our national accreditation. It went very well, and we are anticipating a report soon, which would finalize their review. In March, we are up for our 4-year annual reaccreditation. It's a much more comprehensive look at our policies, our procedures, our practices, our management, and our facilities. So we are looking forward to that. It's always great feedback, and I will report that back to everyone once that has come through. And that's all I have for today. Thank you.
Thanks, Chief. Any questions for the chief? Commissioner Long, I know you're here. Anything from the police commission side you'd like to add?
Oh, we're fine, thank you. I think things are shaping up very well in the department. They're going smoothly. Very encouraged by that.
Absolutely. Excellent. Thank you, sir. All righty. We'll keep moving along. Ambulance, Karen Stewart. Good morning.
Good morning, everybody. Again, nice, short, sweet report. Everything is positive. Everybody's doing well. We're about 100% vaccinated, both with first and second shots. We've had no reported cases of any of our staff or volunteers being sick. We have seen increased call volume. So as I stated last time in the last meeting, we will be ramping up our second ambulance again. We've just hired another full-time paramedic who lives in town, which is great to have some local people working for us. Otherwise, we remain healthy and we have good staffing and good supplies. And again, nothing new, really exciting to report, which is good for us. So if anybody has any questions, I'll be happy to answer them.
No news is good news in your business.
Absolutely.
All right. Chief Baldus, fire.
Yes, hi, good morning. We continue also to be in good shape as far as COVID is concerned. We did have one district staff member who was tested positive, but fortunately due to his work environment and and such that he was actually in no contact with any of the volunteers or any of the other members of the staff. So he did go through the normal quarantine processes, back to work with no issues. We continue to maintain our policies in place, which have been working out quite well, and restricting some of our training aspects to keep them in smaller groups. A quick reminder, obviously, to everyone out there, as we are looking at another snowstorm coming into place, that the shoveling of your hydrants in your neighborhoods is really, really important for us. We did have, in fact, 2 fires recently. And in both cases, I have to happily report that in those cases, the hydrants that were used for those fires were, in fact, shoveled out, which means that we didn't have to spend any time at all, number one, finding the hydrant, or number 2, actually shoveling it out to allow us to hook up to the necessary water supply, and saves a considerable amount of time for us. And in both of these cases, there were no injuries. There was damage to the homes that were involved in the fires, unfortunately. But again, having that hydrant there in both of these cases is really important. So we certainly stress, to our citizens out there, if you do have hydrants in your neighborhood, even it may not be in front of your home, it does protect your home. So we certainly ask that you shovel it out for us, if you would, please. We also have received and have in place now new snow tracks for our all-terrain vehicle, with the continued activities, especially hiking, snowshoeing, cross-country skiing, a lot of activity going on in some of our remote areas of town. One of the things that we have had lacking at that point was if we needed to get any kind of a vehicle for transport from an injury or such into some of these remote areas. Well, we now have that capability with tracks on our all-terrain vehicle that the fire department has in place. We've been doing training on that, and we're very, very pleased with its performance in snow conditions. So we do have that now on the line and in place. So other than that, we're in good shape, just getting ready for the next snow.
Thank you, Chief. Any questions for the Chief? All right. Neil or Mark Kritz, Board of Education.
Yeah, I'm going to start, and then Mark has a piece on a new visitor management system that we are implementing. But let me give you the COVID update to start. We are seeing the same trend lines as the area and state, in that we've had fewer cases and quarantines, which is a good thing. But we still have had cases and quarantines each week. And that we continue to put that data out to the public on our dashboard on the website. So anybody who follows that on a weekly basis can see that we are headed in the right direction, though we're not completely out of the woods for sure. We did have some more employees that were able to be vaccinated. We have employees who are 65 and over, and we're asked to upload them into the VAMS system. So that'll put a dent and get vaccinations to those employees who are at higher risk. So we're quite happy about that. We continue to be able to do well with staffing. With the exception, I worried about it at our last meeting, and it has come true. Salters Express did have to cancel just a couple of routes due to driver shortage. Finding people with a commercial driver's license at this point in time is not that easy. So we have had to cancel 3 different bus routes for just a couple of days each. And we certainly apologize to the families that were impacted on that, but they were pretty good about understanding the situation. So the most important news that just went out from our superintendent probably about 20 minutes ago is that given the positive trends on the lack of school-based spread that we are seeing, we are going to invite a larger population of our high school students back, starting on Tuesday, March 2nd. Juniors and seniors who have expressed an interest in coming back 4 days a week Tuesday through Friday will be allowed to do so. We're going to ramp that up for a week. And then on Tuesday, March 9th, the 9th and 10th graders whose families choose to come back will be allowed. So want to thank the Farmington Valley Health District for supporting us on that. There are a number of area high schools who are making similar plans to get more in-person learning. I mean, it's just a huge difference when you see what we're able to do K-8 and what, attendance at the high school has really been tough, and it's hard to engage people in the hybrid environment or the remote environment. So we are hopeful that is going to go well. We believe it will go well. And otherwise, we continue the wait for our teacher vaccinations. So that's what I have. And I know Mark has prepared a couple of comments about a visitor management system that we're going to implement starting in March.
Morning, everybody. So starting March 1st, the high school is going to be piloting a visitor management system called Raptor. Raptor is used across the state and across the nation at schools. Basically, what's going to happen is visitors are going to come into the school. They will have to stop at the security desk, provide the security guard with a photo ID, whether it be a driver's license or a state ID card. That will then be run through a scanner. The scanner will basically hit two databases. One database is going to be the National Sex Offender Database, and the other database is going to be an internal database that we can put in court orders such as protective orders, restraining orders, and custody orders. Those will be given to us by parents who feel that the other party cannot have access to their children. So once they issue that, give that card to the security guard and it runs through the database, they will be scanned in. If there's a hit on the database, then a billing administrator will be called and come and speak to the individual. If everything is fine, then they will be issued a badge that will not only have their picture on it, but it will also have the location of where they're headed to. So that'll be good for contact tracing should we ever have an issue with that. The other thing is they will also have COVID screening questions so that we can make sure that anybody coming into the building doesn't have any symptoms. And if anybody has any questions on that, I can go ahead and answer them. The other thing with the Raptor system is if somebody does come up and with a hit on the database, then what can happen is they can contact the superintendent's office and ask for approval to come into the building, but they would need the superintendent's approval. Just a couple of quick comments and a couple other things. Like Neil said, with the way that juniors and seniors will be coming back to school soon, we are going to have parking is going to be a premium here. We do still have some residents who do like to come and use some of the fields and courts. Right now, it's kind of tough with the snow, but as things clear off, then we'll have people back. So we just need residents to understand that parking is at a premium. The students do pay for their parking. So we ask that if they do come, they come a little bit later in the morning after the students have arrived and they can find an empty spot to park in. Also, just a little bit on what the Chief Bolter said about the radios. The Salters buses that are owned by the Board of Ed have already had their radios, their mobile radios put into the buses. And our maintenance vehicles have also had the mobile radios installed. The only thing that we're waiting on are the radios, the portable radios for the rest of the staff who will be getting them. Other than that, that's all I have. If anybody has any questions on Raptor system, that's all I have.
Mark, thank you. That sounds like a good change. I appreciate you guys doing that. All right, Maria, the meeting is yours, my friend.
Got it. Very good.
Thank you all. Have a great day.
Thanks, Sean. Thank you.
Take care, Sean.
Great. All right. Next is Tom in Public Works.
Oh, well, good morning, everybody. Couple kind of go in reverse order. Our custodial staff is continuing to clean and disinfect the buildings 4 times a day. With the buildings being open, I think they've really taken a lot of pride in making sure we're keeping everybody safe. We're continuing to support social services with the food distributions and all of the work associated with that. Probably, I think the big news today is that we're looking at a very, very long, but not very intense snowstorm. Somewhat challenging. You know, our department, the highway department, has been down 2 staff members for non-COVID related reasons. A few things that, you know, I always like to say to the public that you can do to help our team out there plowing is making sure that you or your contractors do not blow or push snow into the roadway. Nothing worse for our guys than when somebody has a snow blower that you can easily turn the top attachment and they're firing snow right back into the road. It not only creates a public safety hazard, it creates more work for the plows, which ultimately results in higher costs for our operations. Today is trash day in certain neighborhoods in Simsbury. If you can put the trash can in your driveway, that's going to certainly allow us to clear the roads a lot better. Trash cans are basically built upside down. It's wider at the top, narrower at the bottom. Our guys certainly don't want to knock over trash cans, and that's a small thing that everybody can do to help the guys in the big trucks. And the last thing is, if you need to be out on the roads, give the plows a lot of room. They need to back up in order to do their job. They're backing up frequently. They do not have backup cameras, and especially when small cars get too close to the trucks, they're effectively invisible. So we're hoping that spring will be here soon, but in the meantime, that kind of covers today's operations.
Great, thanks, Tom. Any questions for Tom? All right, next is Kristen in Social Services.
Good morning, everyone. Excuse me. Just a few updates from Social Services. I want to remind everyone that with the inclement weather and the cold temperatures that we've been seeing, that please be mindful that we do not have a warming center open in the town. That's due to our COVID restrictions. If you are in need of shelter or of a warming center, please either contact us or 211 directly so that we can get you some help. The police department is also available to take phone calls after hours or in an emergency, but ideally we'd like to be able to get anybody that needs assistance, get them assistance ahead of the snowstorm or ahead of the weekend hours when help might not be available. Also, a reminder that we're still taking applications for energy assistance. Please know that you don't need to be in the cold and that we can get you assistance in filling up your oil tank or paying your utility bills. And again, please don't wait until your tank is empty. It's super hard to help you when you're already cold. So we'd like to help you in those emergencies before they happen. Social Services also continues to provide Cheese Day, as you've already heard. Still going really well. We're doing kind of a hybrid outdoor walk-up method, and our numbers have been a little bit lower this month, where we served 123 households, and I think that was due to the fact that our Cheese Day was right after we had a large snowstorm. So some people, I think, were afraid of coming out in the weather. But thank you to Public Works for continuing to support us in those efforts to keep our people fed in town. And a few exciting programs that we're offering virtually. Last week, Community for Care offered a program on domestic violence, and we had some really excellent panelists. That's available for your viewing on SCTV, and I hope that people do check that out. And coming up, we're going to have a few very exciting virtual programs through our Youth Service Bureau in conjunction with our schools and a few local community partners. We're going to be focusing on the mental health and well-being of our youth, and also opioid prevention and substance use prevention. We're going to have some special programming for both parents and for the youth. And as you've heard in the Senior Center, we've been very busy partnering with the Farmington Valley Health District and our other local senior centers in helping our first 75 plus and now our 65 plus to register for the vaccine. We encourage anyone that's having any difficulty in registering in the vaccine, or anyone that would prefer to work with us, to contact the Senior Center directly at 860-658 3273. Please be patient with us. We have been getting upwards of 100 phone calls a day, so it might take us more than 24 hours to get back to you, but please know that we will return your phone call. We have vaccination clinics available in many of our surrounding towns on a more than weekly basis, several times a week. So we will get you in to get your vaccine. And our Dial-A-Ride buses are up and running. If you need transportation for the vaccine, we can help you to arrange for that. Dial-A-Ride is following COVID precautions, but we will help you with those needs. And that is one other thing before I conclude my report is that we are aware that there are folks in town who may be homebound. We have gotten requests for assistance with the vaccination if you are homebound. Please know that we are very aware that that's important to you. There is not yet a mechanism in place to vaccinate our homebound seniors, but we are working on that with our partners, and the Senior Center is keeping a list of folks that might need that. So please let us know if you need that service. And I'm here if anybody has any questions, or you can reach out to me anytime after the meeting. Thank you.
Yeah, Kristen, thank you. I just really want to recognize Kristen and her staff. It's a very small but mighty staff of 5. And, in addition to providing their normal, casework and direct service work, services to our residents, during the pandemic, they've just had to take on so much, additional responsibility, whether it's registering, folks for the vaccine or, our food program almost doubling in size. And again, for 5 folks, wow, just remarkable work that you all have been doing, and just also really want to thank the volunteers that have been helping us as well, whether it's helping us with the food program or we have a small number of folks, including one of our Board of Selectmen members. Just a shout out to Wendy. Thank you for helping us returning those massive amounts of phone calls we're getting from folks who need help registering for the vaccine. So it's a team effort, and I really appreciate everybody who's been pitching in to help us get that done. So thank you, Kristen. Great. Any questions for Kristen? All right. Next is Nancy in the BNA.
Good morning, everybody. Thanks for the shout out from the police department. We are busy working with the health district. We are currently doing at 3 vaccination clinics a week, and the kind of beauty about that is that, like tomorrow, for example, mostly the clinics are Monday, Wednesday, Fridays in the in various spots in our Farmington Valley towns. We have moved over to East Granby High School because that vaccine location can let us do upwards to about 500 people a day. But we still remain in Avon, in Farmington, now at the Senior Center instead of the police department. So we're probably vaccinating close to 700 or more people a week. And in the event of a snow event, like there will be one tomorrow, we at least have Tuesday, Thursdays to kind of take all those people that are already scheduled and move them to an alternate day. So we're not missing anybody and we're not getting backed up. Just to let everybody know, we are certainly, we have had to fill out a survey with the Department of Public Health so that if and when the state can help design the process of our ability to actually get vaccine directly to go out to homebound people, we will start to do that process. It just is not in place yet. We have, like everybody, gotten a lot of calls about, so many people that just cannot get out. We certainly have more than just our patient population. And so a lot of the home health agencies have been reached out to say who wants to volunteer, and we have done that. We just haven't gotten the process yet. Right now, vaccine is only getting distributed to the larger players like hospitals or the health district. So none of us have the capacity to actually get that directly and then take it to people. But when that process gets developed, I'll let you know, as I'm sure Jennifer will. And then, we can try to meet the needs of people who cannot get out. We are fortunate. Our staff is 100% vaccinated, which sort of makes you start to feel like you can be free again, but we are still following all the recommendations. And just to let everybody know, the CDC did come out with new recommendations that the Department of Public Health and the governor have kind of pushed out to all of us with regards to obviously continuing to do the things that we're doing, but making recommendations about how well fit your mask is, as opposed to just doubling up and tripling up, because putting two medical surgical masks on really does not assure a better fit. It just actually makes it worse. So, you know, information is constantly changing. We're trying to stay up on that. We have the ability to go out, and if, you know, towns are concerned about anybody in the community that they want us to go check up on, we are available to do that. So let me know if you have any questions or needs.
Nancy, thank you so much. Any questions for Nancy? All right, next is Sarah and Main Street Partnership.
So I'm going to be brief because we have no new updates of note. We are continuing to work directly with the Farmington Valley Health District on business complaints and issues, things being reported through the 211, as well as issues that the businesses might have. We're continuing to assist businesses on all COVID-related issues, PPE, grants, marketing, vaccine information, et cetera. And just a reminder that all of our Simsbury businesses are offering safety things such as curbside pickup. A lot of them also offer delivery or shipping options so that people can continue to shop and dine safely for those that are worried. So that's all we have this month.
Great, Sarah, thank you so much. And thanks for all your efforts in supporting the local business community. We really appreciate it. All right, Mark, any updates from Eversource? And I wasn't sure if you might like to introduce your colleague.
Sure. My new colleague TJ McNolly is joining us. He's a whole 3 days into his Eversource tenure, and just working with him, kind of guiding him in his role within our community relations and economic development group. I invited him to join this meeting because most communities don't really have this type of meeting that the wide breadth of information is shared across the town or the city that we work with. So I think this is a great forum and it's something really interesting for him to see. So I invited him to join me this morning. I just want to quickly, I know I've talked in the last several months about some of the special payment programs that we are offering. And we're really encouraging that, especially on the residential front. Maria, I know you mentioned, especially a lot, the increased number of unemployment claims and many people that haven't been in a situation where they may not have had to contact us in the past. We have quite a few programs available. We actually have a couple of webinars that they can sign up for right through our website that are going to come up next Wednesday. There is one this morning at 10, but I know if someone's not watching right now, they're not going to see it. So next Wednesday at 11 a.m. and 6 p.m., they could sign up right through our website. It goes over a myriad of programs that are available. And then also, very importantly, with many people still, working from home, kids going to school from home, we're using lights and computers and all of that much more than we ever have in the past, 24/7 in many cases. So energy efficiency is really, really important to think about, whether we're changing light bulbs at home, doing the tune-ups of our heating and cooling systems at that point during the year. But I would encourage anybody to go, whether it's a business or a residence, to go to energizect.com. There's information about rates, so you can look at different supplier rates even for your home. And then also energy efficiency programs that are available at low cost for residents or no cost for income eligible customers if they fall within those the federal income guidelines. So there's a lot available. I just encourage you to look at our website and then Energize CT. And a lot of those energy efficiency programs are fuel blind. So whether you heat with gas, electric, or oil, those programs are really top notch, nationally recognized programs. So just encouraging everyone to take a look and, take advantage of some of them, where there are some things that are really, especially for insulation and so forth. People that are income eligible may even be able to get insulation after their audit at next to no cost. So just take a look at those websites, and if anything comes through your offices, let me know. I'll be happy to speak with anyone. Thank you.
Great, Mark. Thanks so much. Any questions for Mark?
Maria, if I could, I just want to kind of echo what Mark was saying and kind of highlight that our Clean Energy Task Force has really been pushing the energy home audits, and that's the 1877 WISE use is the number you call. Right now, the program's 100% free, and because I kind of wanted to practice what the Clean Energy Task Force was preaching, we had an energy audit at my house this week, and it was fantastic in what they're offering. It's a wonderful program. It's low cost, and it's going to save you a lot of money. So.
Great. Thank you, Tom. All right. So I believe our next meeting is March 18th. I was just checking my calendar. I think that the calendar invite actually has a typo. It says 8:30, but we'll be at our normal 8 a.m. time. So we'll go ahead and get that corrected and send that back out to you all. At the time we set up the calendar invites, I think we weren't really quite sure where we would be in the spring in terms of meeting in person or virtually. But I think at this point in time, we are still continuing to meet virtually for all of our agencies and our bodies. So what we'll do is we'll also send along some Zoom information for that March meeting as well. And then before we adjourn, does anybody else just have anything they'd like to add for the group?
Yeah, Maria, this is Jim. I was remiss in my notes. One thing I forgot to mention, when Farmington Valley Health was here doing the clinics, I just wanted to give them a shout out again. Every day that they came in, they left the place actually better than they found it, and we can't thank them enough for the effort that they put in to doing this, and also making sure that our facility was left in the great shape that it was. So thanks very much.
That's great. Thank you. All right. And with that, I think we can adjourn. I know Sean will usually do a formal motion for that. Is there a motion to adjourn?
So moved.
So moved.
Great. And the second?
Second.
Great. Thank you. All those in favor?
Aye.
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 Great. All right, everybody, thank you so much for your time today. That was really helpful. We appreciate it. Take care and stay safe.